Now, very commonly, what we can see is so many people struggle to define constipation. Now, we have very wonderful diagnostic criteria as per Rome 4 criteria, which has around 6 points, out of which there must be at least two or more than 2 points. If these are present, then we can simply label that the patient has constipation. The first is the patient must have straining during defecation for more than 25% of defecations. So either it can be during one single defecation that the patient has to strain, or it can be the number of defecations. Suppose if the patient defecates or passes stool for around 8 times in a week, then if he strains for more than 2 times, while out of these 8 defecations, we can still label that the patient has straining during more than 25% of the defecations. So it is one of the criteria for constipation. The second thing very commonly is patient won't get soft, well volume stool. Patient may get lumpy, hard stool, which can be very, very difficult to pass, which can be painful while passing. And that too has to be for more than 25% of the defecations. The third criteria is कि even the patient goes for the passing stool, even the patient defecates, there can be still sensation of incomplete evacuation for more than 25% of the defecations. That is the reason why patient may need to go to the bathroom or loo for more than 1 or 2 or 3 times, because they will feel that their stool is not completely evacuated and they need to go again to pass the stool. This is the third criteria. The fourth criteria is the patient may have a sensation of anorectal obstruction or blockage for more than 25% of the defecations. So it is just like the same criteria where the patient may feel that the stool is not completely passed and there is something which is obstructing into their lower abdomen, and most of the time for the same reason they again go for passing stool again and again over a period of day. So they may go for a passing stool for 2 to 3 to 4 times per day, just because they have sense of anorectal obstruction or blockage. The fifth criteria, which is very, very important, is the manual maneuvers to facilitate more than 25% of the defecations. So most of the time, many of the times, it is so difficult for the patient to pass the stool. They can feel that their stool is very, very hard and it is stuck into the anal canal. So how to get rid of it? Whenever they go to pass the stool, they simply do digital evacuation. So they remove some portion of their stool with their own fingers, or they can simply take support of pelvic floor. So they may significantly strain to remove the hard or impacted stool in the anal canal. This is the one of the important criteria. And the sixth criteria is less than 3 spontaneous defecations or passage of stool per week. These are the 6 criteria for constipation. Patient must have two or more than two criteria to label that the patient has functional constipation. Uh, IBS or irritable bowel syndrome can also present with constipation or constipation-like symptoms. But one of the most important thing to label for irritable bowel syndrome is that very commonly in irritable bowel syndrome, whenever there is stress, the patient will have change in stool consistency. So this change in stool consistency, very commonly, they have a white discharge also, which is very commonly mucus. So this type of mucus thing is not seen with constipation. And change in stool consistency, that too with stress, is not very common with constipation. And other thing is key, the irritable bowel syndrome patients very commonly have a very abnormal abdominal discomfort, which is not usually defined as pain, but they always keep saying that they have this abdominal discomfort. Whereas in constipation, the sense of discomfort, abdominal discomfort, is compared to much, much lesser. So this is how we define constipation as per Rome 4 criteria. Thank you.